Hello everyone. Today I'll be going over Madeleine Leininger's cultural care, diversity, and universality theory. It's a framework of how nurses to take care of patients. Leininger's main point is simple. Caring is the heart of nursing, but care must be culturally congruent to be safe and effective. Cultural care includes the values, the beliefs, and ways of life that supports a person's health. When we provide culturally congruent care, our nursing actions fit the person's worldview. This means we recognize both diversity, how different cultures understand care, and universality, the things the cultures have in common. The theory shifts nursing from just performing tasks to working with patients to plan care. Leininger connects culture to the four major nursing concepts. The person includes individuals, families, groups, and communities from different cultures. Environment includes social, political, religious factors that affect health. Health is defined by what each culture considers well-being, not just medical standards. Nursing becomes the intentional use of cultural knowledge to support, maintain, or negotiate care that improves health. The real strength of Leininger's theory lies in her three modes of action. First is cultural care preservation or maintenance, which supports helpful cultural practices such as special diets or spiritual rituals. Second is cultural care accommodation or negotiation, where nurses and patients work together to adjust care when cultural beliefs conflict with medical needs. This is the focus of my clinical example later on. Third is cultural care repatterning or restructuring, where nurses respectfully help patients change harmful behaviors like smoking or eating habits to improve their health outcomes. This theory applies to both wellness and illness. In wellness, we use preservation to support healthy cultural practices and repattern to adjust health risks in a respectful way. In illness, accommodation and maintenance become especially important, especially when spiritual or traditional beliefs affect treatment decisions. For example, during end-of-life care, supporting a patient's spiritual rituals can be just as important as medical interventions. Because of its flexibility, this theory works well in community health, acute care, and many other settings that we can see patients in. The main strength of Leininger's theory is its focus on holistic, personalized care. It strengthens nursing by viewing care as both a science and human connection. By empathizing the patient's emic or insider perspective, it encourages active listening and improved communication. The theory also offers a clear way to address cultural and ethical conflicts instead of arguments. It promotes collaboration. This reduces moral stress for both nurses and supports professional integrity. Although valuable, the theory does have some challenges. It can be complex and time-consuming since cultural assessments take time. Time is something that is often limited in emergency or critical care situations. Some ideas are abstract, which makes it hard for new nurses to use the theory consistently. There's also a risk of stereotyping if nurses assume instead of truly learning about the patient's beliefs. Finally, cultural information is often hard to document in electronic health records because it doesn't always fit standard formats. For example, imagine a Jehovah's Witness patient who needs major surgery but refuses a blood transfusion for religious reasons. Using Leininger's theory, the nurse practices accommodation and negotiation. The nurse understands that the refusal is based on faith, not confusion, and then works with the surgery and anesthesia teams to use bloodless methods such as a cell saver device and special medications. This approach respects the patient's beliefs while maintaining safety and by showing what truly culturally congruent care looks like. A helpful scholarly source that supports this is Dr. Josepha Campina Baco's model of cultural competence, which builds on Leininger's ideas. Dr. Josepha Campina Baco stresses that cultural care is not just awareness, it requires action and skill. In the surgical example, using Leininger's modes of care is the practical skill that turns empathy into real results. It prevents ethical conflicts and improves patient cooperation. Both models show how cultural care can be compassionate and evidence-based. In conclusion, Leininger's cultural care diversity and universality theory is not only theoretical, it is a practical guide for modern nursing. It teaches us that respecting a patient's cultural background is essential for ethical and effective care. Through preservation, accommodation, and repatterning, nurses can connect scientific care with human values. This builds trust and ensures that every patient receives care that is both competent and culturally respectful. The following slide is references used for this presentation. Thank you for your time, your attention, and being the audience for my presentation.